Dr. Lalade here at Ask the Gynecologist. I'm hoping my audio is good today. Today we'll be talking about blocked tubes and um, low sperm count. Yesterday was our ATG seminar. It was a free seminar, and you don't have to pay to attend the seminar yesterday. It was a free masterclass, super sex masterclass seminar, and people joined yesterday. People were happy and they learned a lot. And if you missed that seminar yesterday, it's high time you go to the seminar page for that particular masterclass, and you can watch the video over and over again at your own free time. Once again, my name is Dr. Lalade, your host today at Ask the Gynecologist, and we are live on Instagram, live on Facebook, as you can see me, and we're also live on YouTube. If you're not yet aware of our YouTube channel, you can join now. We are always live, and sometimes we even post recorded, edited videos on our YouTube channel. You can see my name clearly written on my chest, so it makes it easier to identify me. I want to say good evening to everyone watching tonight. I can see Mariel Khalid Agbo, Eniola Debisi Anike, Glory Chiamaka, Mari Khalid Agbo, Rosemary Tobe Chuku. How are you? And good evening. And I want to wish you the best of the Christmas season and also of the new year coming ahead. It's going to be a wonderful one. I'm out of Facebook confinement now, and we can go live easily without any problems. I can also see people that are already watching on Instagram. Good number already on Instagram. We have people with Zini B, Andromeda Dame, Dan Claw, Adaro Batil, Bade Adebola, and Jaisadina. And so many names on Instagram that is difficult to pronounce because most of the names on Instagram are like acronyms. Anyway, we are here tonight and it's a wonderful time and it's going to be amazing as well. I can see Doris Uche, Gabriel Uche, Mame SC Enison, Isoken Adacha. How are you today? How are you doing? Martha Thoyin and people already here waiting. Echebiri, Rosemary, Glory Chiamaka Kelvin. And if I've missed your name, please apologies and please, I'm so sorry about that. I don't want to miss anybody's name, but I have to keep flipping through all the screens to ensure that I can capture everybody. Echebiri was Mary Victoria, Ifanaya, Cheesy, Maurice, KK, Komi, George, Patrick, and almost Aliwa Basiraton of Americas already. He's on now. We have Enihi, Bernard, Adebayo, Adiola, Cheesy, Maurice, KK. Tonight is a wonderful one, and we're talking about infertility that is caused by blocked tubes and also by low sperm count. So if you're free, join me. Like you know, always, I don't like taking too much of your time. I know your time is precious. I won't go beyond more than 20-25 minutes just to keep our mind alert to these things. Lolade Alabi Inzewi, Lilian Ayanele, Messi Nwosu, Inkere Sarah Okonko, Rabiat Asan, Oluwabumi Oluwadamilare, Chris Zon on Instagram, Uyi Sugar, Kuzulu, and people that are on YouTube, I can't see your name yet. Let me see if I can see any comments. On YouTube, we have people watching on YouTube. We have about 2 viewers on YouTube now. Thank you so much and good evening once again. My name is Dr. J. Babaji Dalalade at Ask the Gynecologist. Faith Raymond, Chef Jane Momo, how are you? Adebikola Yinka, Yinksberry, Chiamaka Onyejekwe, Chidima Rosalyn Otujo. We have I am Oge Wayne. We have Titilayo, Oladoye, Olafusi, Ezenwale, Obioma Onyechi, Rosemary Ubia, Confidence, Nadozie, Chef Jane Momo, all the way from Abuja, Nigeria, wonderful lady. Christina Idowu Adeyemi Akomu, one of our moderators here and models here on the ATG section. So, without wasting much time, I want to introduce everyone to ATG. ATG, as you know, is one of the biggest resources of gynecological health issues on Facebook. We opened shops November 2015. 15 years we started. I started the group, and exactly 7 years now. You know what it is to run a business for more than 3 years, much less 7 years, and we are always every day for the last 7 years we've been on here, and it's because we love what we do. And over time, you can see that ATG is not just online. We are footprints. We don't walk by night. We walk by day and night. And we put our names beyond and attached to our words. We don't speak empty words. We put ourselves evidence-based behind and backing up everything we discuss here on ATG. Over time, you're aware that ATG has evolved. We've had one previous app before. Now we're creating another one which should be out before now, but delays through iOS has confined us to slow turnout. But we are there, we are getting there. And ATG as well has not wasted time to open our own laboratory and subsequently our own IVF center. The reason why we open this is not because of profit, is because whenever we refer patients to laboratories or to IVF centers, we don't get feedback. And people we refer there are not happy because we don't know what has been done to them. So we decided to open our own IVF center and our own medical laboratory so that we can ensure quality assurance and quality improvement is totally well done in-house. And by the grace of God, we've been able to achieve this, and we have not stopping. People have not been able to come all the way to the mainland to see us at our IVF and laboratory centers. So we are coming and bringing our business to the island so that people do not have to go through the stress of traveling in traffic in Lagos State to get to where they need help. So we are bringing help to your doorsteps, and that we'll do without fail by the grace of God this coming year. And I have no doubt as well, Abuja is our next point of call, and Ghana is not far behind. We are coming there. So definitely we're making progress. We don't just stay online. We put our foot not in the sand, but in the sands of time, so that people can know that we're not just there. And if you walk around or you move around Lagos State and Limosho area, you will have seen our name on the walls of the major expressway there. We are there live with not 419. And anything you do in ATG, always ensure that before you make any payment, ATG account. When you pay to ATG, you don't pay even to my account. You pay to ATG account, wherever bank we use. From the next year, coming January 1, we'll start using our Providus account. We're moving away from our Access Bank account, but it is still going to read ATG. If you don't see ATG before you make any payment, don't make a payment. Maybe it's before 1419. Always ensure that any account you're making payment to for any of our ATG services is always labeled ATG. Okay, ATG, Ask the Gynecologist Nigeria. So we know there's been many imposters, people trying to replicate what we do. Yes, knowledge is not monopolized. Knowledge is free, and knowledge is a free resource. There's no monopoly of knowledge. Yes, but but you can change things by your attitude and the enthusiasm you put into things. That is why at ATG we put our heart into what we do, and that is a very rare thing. We don't waste time. We don't slow. In ATG, there are many ways you can contact doctors at ATG. We have spread out people, moderators who can attend to you 24/7 all the time to ensure you're not lost. A big group like this, we need moderators to guide people, to tell them to know where to go and how to get help when they come to the group. We have our premium services, and we have the platinum premium services, which is a gold consult, a gold video consultation when you see me talking to you on the phone like this. That is the platinum service. We have the diamond service, which is available for phone call, the gold service for WhatsApp text. We have the monthly consult and the weekly consult. And for those that cannot afford that, we have the general Telegram open group for antenatal, which is manned by Dr. Esther, and also for GTC Telegram group managed by Dr. Esther as well. These are one of the ways you can easily get attention doctors. If you send me any message through my Facebook Messenger box, I'll probably not see them because my Facebook Messenger is absolutely full. It will take me to employ a new human being to go through the messages. To be honest with you, it's a difficult thing. I don't even go there at all. So if you want to get across to any of our doctors, just speak to our moderators here. We have about 7 moderators on ATG. They will guide you how to get resource and help. Ajay, Anna, Ene, Okwori. Thank you, Christina. Thank you, Mashalewa. Thank you, Olatubosun, Moyoseri Olua, Favor Maka Ogu, and Zion Peace, and everybody watching here. Definitely, if you're a member of ATG, you will have known about 5 important things to ensure you get pregnant. And when I say 5 important things, I say these 5 things must happen. These 5 things must happen to ensure you're able to get pregnant. And what are those 5 things? Number 1, you must have done a scan to ensure that you have a womb, you have a uterus or a womb. It's the same thing. You got ovaries, okay? Most people don't know whether they have ovaries or not. The first thing on your infertility journey is to ensure that you have a womb and ovary. Number 2, ensure that your husband's sperm count is good by doing semen analysis. Number 3, have regular sex 2 to 3 times a week. 2 to 3 times a week if you're trying to get pregnant. Even if you're trying to get pregnant, you want to enjoy your life, there's nothing bad in having sex 2 to 3 times a week. And when I say 2 to 3 times a week, I mean 2 to 3 separate days. Okay, you may want to have 1 or 2 rounds in each of those days, up to you, depending on how strong you are. But it must be 2 separate to 3 separate days. Okay, if you have sex 3 rounds on Monday, it's not 2 to 3 times a week. Oh, that is just 1. Okay, so it's 3 separate days or 2 separate days, maybe every other day over every week. Okay, the only time you're free from sex is during your period. That's number 3. Number 4. Is that number 3? Number 4, you must do ovulation test to know if you're ovulating or not. That is your hormonal profile. We check your FSH hormone, prolactin, progesterone, day 21, LH hormone, and all this stuff to ensure that you're ovulating. Because if you're not ovulating, you're not going to get pregnant. Okay, we want to know whether you got polycystic ovarian syndrome by doing your hormonal profile. We want to know if you still got good egg reserve by doing your AMH. We want to know if you're still ovulating by doing your FSH. Okay, and last but not the least, you should also do your HSG to check that there's no blockage in the tubes. And that's what we'll be focusing on today. Now, before I start, I'm using a wireless mic. I want to know whether everybody can hear me on Instagram, on YouTube, and on Facebook. And if you can hear me clearly on Facebook, kindly give me some thumbs up so I will know that you can hear me clearly, loud and clear. Just give me thumbs up like this, okay? So I'll continue. Now, I always have a model here behind me of the uterus. The uterus, we call it uterus, is called the womb. You will know it as the womb all the time. Uterus is the womb. Uterus is the womb. By the way, we are live on YouTube. Anytime we talk here, you can watch us on Instagram Live, on YouTube Live, and on Facebook Live. So if you're seeing me, you can see my finger. That's on Facebook. This is on Instagram, and this is on YouTube. So everybody's watching me live, and if you can hear me, just give us some thumbs up there and show us some good love. Okay, now this is the womb. Everybody can see this from afar. That's the womb. You can see it here on Facebook, on Instagram, and on YouTube. This is where everybody came from, whether through cesarean section or through vaginal delivery. Everybody has passed through this place before, and at some point it was our real estate, our prime real estate. So we don't mess about. I don't play about or mess about with the uterus. The uterus is the place we all came from, or place where other people will come from. And if you're a woman, by the grace of God, that womb God has given to you is for a purpose, and that purpose is to carry your own child if and whenever you want to, as much as you want to, by the grace of God. So that your womb is like a soil. Your womb is a fertile soil. And by the grace of God Almighty, whatever has delayed your success, whatever has slowed down your success, whatever has delayed your success, journey to pregnancy, today I believe and I speak forth to you that problem is dissolved, and that problem is consumed today by fire, by force. Your womb will open. If it's blocked, it will open by the grace of God. You will carry your own blood. You will carry your own child to your womb by the grace of God without fail this year, this coming year, without fail. If you believe with me, say amen in any religion you believe. Whether you're Muslim, it's okay. Christian is okay. Whatever you believe in, as far as you believe there's somebody above you, that's all you need here to have faith and to believe that your portion shall be success as other women have had. So your womb is designed to carry your own baby at your own time, whenever you want to, and as many times you want to. Your womb is fertile and it will hold the baby, and you won't miscarry or abort your pregnancy. When it's time for the fruit to drop from the tree, the fruit drops. The fruit is never in a hurry. Your fruit will not drop before it's on time. Your fruit will not abort. You will carry to term and you will deliver peacefully without any complication. Infection or blood loss will not be there. You will lose blood the way it's supposed to be lost, not more than that. No infection, and you will heal and you'll be back again to carry your own fruit again. So now, what can make a man to have low sperm count and to have a woman to have blockage in her tubes? That is what we'll be discussing tonight. Now, as you can see here from this small ceramic piece here of the womb, the tubes are on either side. You can see them, okay? And the ovaries are here, 1 and 2, okay? You only need one perfectly functional tube to get pregnant. You only need one perfectly functional ovary to get pregnant, okay? Now, if you've been trying to get pregnant, don't be in a hurry to be worried. You should have regular sex for at least a year, okay? Up to 2 years before you start worrying. If you're over 35, you having sex for more than 1 year, you were married, regular sex, start doing investigation. If you're less than 30, focus on sex for at least 2 years regularly, as I've explained to you, before you start getting worried about infertility. Okay, now let's continue. To know if there's any blockage in the tubes, there are many tests we can do, but the commonest test is HSG. HSG is stereosalpingogram. I'm sorry that my board, not everybody can see my whiteboard here because the camera position. But if you are on Instagram, you should be able to see this, my handwriting on the wall. And if you're on Facebook too, you might be able to see it clearly as well. HSG is stereosalpingogram. Okay, it's an X-ray test. Okay, we put in dyes. Okay, the dye will pass through. Let me come back here again. The dye will pass through by the doctor. It's like water. It's not water though. It's a contrast dye. It goes into your womb from vagina. We're flushing the dye. It goes into your womb cavity, and then it flows onto your tube on the right and onto your tube on the left. And they will now wait slowly for the dye to go through the tube. It takes about some few seconds, and then pour out of your tubes into your tummy on this side and on the other side here. We now take x-rays, okay? While taking those x-rays, we're looking to see the flow of the dye on either side, like it will feel like water, like white, on this same side too. After a while, your body will reabsorb the dye and it goes into your body. No harm done to your body. It's designed to work that way. We see that your tubes are open on both sides. If there's no flow, okay, we can repeat that HSG immediately there. If you're comfortable for that, we repeat it. And if on 2 attempts we can't see anything, we conclude that it's possible that your tubes are blocked. And if your tubes are blocked, we'll talk to you now after how to get that remedied. So hold on. Now, some people, only one tube will have a dye come through. As far as you have one perfectly functional tube, you're okay to get pregnant with it. You're worried, okay, but doctor, if this tube is okay and only this egg comes out from this other ovary, how will it get into the tube? As far as that tube is okay, your body has a way of picking the egg. This tube can pick the egg. Some people, we've removed their tube, one tube from ectopic pregnancy. They've only got one tube. When they release egg from this ovary here, this tube here can pick it up. So even if you've lost your right tube, your left tube can pick up eggs released from any of the ovaries. Okay? So you only need one tube to get pregnant. Many things can cause tubal blockage. I've always preached it here over and over again. Infections like chlamydia, gonorrhea, and bacterial vaginosis, they can cause PID. Any infection in your vagina, okay, apart from yeast infection anyway, has a potential to move into your womb cavity and move into your tubes and into your tummy and cause what we call PID, or even worse still, tubo-ovarian abscess. And it can cause damage to your tubes. The more you have repeated recurrent infection in your tube, the more your chances of having your tubes blocked forever. You have one infection, another one next year, another one next month, it continue to damage your tubes and it's blocked forever. If by the time you have 2 or 3 chlamydia infection or gonorrhea infection, your tube is probably gone. So anytime you notice infection down below in your vaginal area, it's important you get swab done and treat accordingly. Sometimes before we get your swab result back, we give you antibiotics to cover every possible antibiotics. And once we get your swab result, we know, okay, should we still continue on this antibiotic we've given you, or should we change to something more specific? And that's what result will give us a guide to know if we should continue on that antibiotic we started you on, or to change it to something entirely different, more specific. So it's always important you get swabs done. If possible, you think you have an infection in your vagina, please don't take it joke. Your vagina is like an open wound. Your vagina is an open door from inside to outside, outside to inside. So don't take it for joke. It's amazing why some people will put anything. Like some people will put anything they put in the junkyard, in a bin, into their vagina, all in the name of vaginal cleansing and so called. But they've forgotten that the vagina is an entry open door into your tummy. Anything that can stay in your vagina can automatically move into your tummy and cause infection. So be careful and don't even put anything in your vagina. If you put anything in your vagina, let it be your husband's penis. Let it be maybe your sex toy that is clean. Okay? Maximum. Okay? And it's also important that if you're not in a stable relationship, if you don't know the status or the seriousness of your partner or sexual partner or your boyfriend or your spouse or your husband, it's important you use condom during sex. So it's important. So prevent infection. And if you notice you may have an infection, get it treated on time. Another thing that can cause damaged tubes is previous ectopic pregnancy. Now, you having infection in your tube, causing damage into your tubes, gives or increases your chances of having a damaged tube that can cause ectopic pregnancy. Your tubes are damaged, eggs can't flow freely inside there to get into your womb. They get stuck in the tubes, it causes PID. I can tell you something. Eggs that is released are visible to the naked eye. The egg is quite bigger, far bigger than the normal sperm. Sperm is very microscopic, but eggs can be seen with a very good lens. With a good magnifying glass on, just like that, you can see proper egg released, ovum released. So eggs are quite big. Any damage in your tube will cause the eggs to be stuck there, and sperm can go and meet them, fertilize them there. They fertilize in your tube, they implant in your tube, and they burst, they rupture the tube, and that person can bleed to death. So ectopic pregnancy is number one cause of complication from infection, damaged tubes. Your tube is damaged, it's not entirely blocked, it can't allow egg to pass, the egg is stuck there, egg is fertilized in your tube, the tube is not designed to hold pregnancy, the tube ruptures, you bleed into your tummy, becomes an emergency. So it's important. Okay? Ectopic pregnancy, once it's in the tube, we have to take away that tube, and that tube is lost forever. But as far as you still have one good tube, it's okay to get you pregnant. I saw a lady last Thursday. I did HSG for her. She's had a previous ectopic pregnancy on her right tube, I think in 2019. So she was coming today, last week, to have HSG done to check if that leftover tube on the left is still okay. We did HSG for her, and that left tube was okay. We gave her a green light, good to go. HSD is not designed to unblock damaged tubes. I've seen people, yes, that they got pregnant shortly after the HSG. Maybe there was some debris or blockage in the tube, and the HSG, the faucet of itself, opened the tube. That's okay for them. But if that happened, good. But if you've been told that your tubes are totally blocked, okay, HSD is not designed to unblock it. Don't forget that. I think I'm losing some battery power in my phone here, so I'm going to plug it onto the charger. Hold on, guys. Good. Let's see. So my sound might change a bit on Facebook because I'm off my wireless mic. So let's continue. What can cause blocked tubes? No, it's not everybody that has blocked tubes that had an infection. It's not everybody that had blocked tubes that had an infection or has played the way match. Some people do have blocked tubes, maybe from endometriosis. I'm sure if you're a member of our group by now, you know what endometriosis is. We've talked about it a lot and so many times. If you don't know what endometriosis is, go back to our Facebook general page and just search the word endometriosis, and you see description pictures of what endometriosis is or what they have. Endometriosis is when the cells in the womb cavity, you see that womb cavity opened? You can see a brown part, that's the outside. You can see the red part, that's the inside the wall of the womb. You can see a pink part, as pink as my lips, that is the cavity of the womb. It's as pink as the vagina is. That area is where the pregnancy implants, where if you don't get pregnant, you bleed every month. For some reasons we don't know, many theories we don't know, the cells there that normally bleed out every month if you don't get pregnant, they can move outside, they can implant anywhere on your womb, inside your womb wall, on your ovary, on your tubes, even on your tummy, even as far as your lungs. And every time you're having your normal bleeding, they will swell, they will stretch. Those cells will stretch and they'll cause you pain. That's why your pain is there all the time during your period and after, before your period. And as soon as your period comes or goes away, the pain stops because those cells will shrink back. If they're implanted on the ovary, on the tubes, they can damage the tubes. So endometriosis can damage tubes. If you have severe endometriosis, stage 3, stage 4, it's probably going to damage your tubes. The treatment of endometriosis is obviously to remove them through surgery or to give you some medications that will shrink them. But unfortunately, the good medications that will shrink endometriosis will make your ovaries not to ovulate, make you have what we call premature menopause. And if you're not ovulating, you're not going to get pregnant, definitely. So, unfortunately, it's a difficult situation. If your tubes have been damaged, okay, by endometriosis, the answer is surgery to remove the endometriosis. And then we now do HSG again. If still yet the tubes are shown to be blocked on HSG, we have to think about IVF. HSG is not the only way we check for blocked tubes. We can also do laparoscopy and dye test, but that is more extensive. We need more skills for that, and the equipment for doing laparoscopy and dye test is expensive because you're going to be asleep on an operation table, asleep with anesthesia, taking care of your breathing. We make a tiny cut in your belly button, put a camera there to see inside your tummy. At the same time, while doing that, we're pushing a dye, blue in color this time around, will move into your vagina, into your womb cavity, and the dye will spill from your tubes outside into your tummy, and the same thing on the other side. And we'll capture that, we'll see that naturally as it's happening in real time with the camera looking into your tummy. So we see the dye coming out of your tubes into your tummy. That is laparoscopy and dye test. And during that laparoscopy and dye test, we can treat any ovarian cyst you have or endometriosis you have. Okay? We can also do hysterosonogram to check for blocked tubes or not. Now, what can also cause damage to your ovaries, to your tubes? Ovarian cysts. I've seen people that have massive ovarian cysts that has damaged their tubes. It's very rare, but it can happen. Where your ovaries, the cyst is so big, it's twisted on the tubes, and basically the tubes is dead. The tubes are dead. It can happen, but it's usually on one side. But it's very rare. If your tubes are blocked, you can't get pregnant. The next question is, doctor, what do I do? Now, doctor, you've said all this, your medical jargons, everything you know, but my tubes are blocked. What can I do to get pregnant? Let me tell you something. I don't want to kid you. I don't want to lie to you. If your tubes are blocked, there are two ways to handle it to get you pregnant. Number one option, which is not very reliable, 4 to 25% rate of success, so it's so wide, it's not very good, is what we call hydrotubation. Doing hydrotubation, which is very archaic and old and not very reliable, with forcing a fluid under high pressure into your womb cavity and pass it through into your tubes on either side to unblock any blockage in your tubes. It's not very reliable, it's very uncomfortable, and sometimes can be totally a waste of time. It can even cause further infection. If you want to try, you can give hydrotubation a trial, But if it fails, or if there's no expertise for that, the best thing would be to consider a very expensive option. And then you say, why would I choose IVF when I can do hydrotubation? No big deal. Give hydrotubation a chance, see what happens. If it works for you, good. If it doesn't work, then you have to start thinking of IVF, but have IVF at the back of your mind. Now, for IVF, many options are available, obviously. If you're ovulating, you got good eggs, you can use your own egg during IVF to get you pregnant. If you're not ovulating, no eggs anymore, your tubes are blocked, there's IVF and egg donor. If your husband has a problem as well, he's got no sperm, start thinking of IVF and sperm donor. Hopefully you have good eggs. Now, let's move to, I know you're going to have questions now. We'll get there. Okay, let's move to low sperm count. What can cause low sperm count? Is everybody still with me? We still got some time here. We spent close to about 20 minutes, 28 minutes. I usually like spending about 20 minutes on my live discussion, but because the big topic today there are two topics in one, I'll probably go more than that. Okay, so let us continue. For questions, hold on, you're gonna get there. Yes, some IUD sugar. Some people can do fallopian tube anastomosis or recanalization. Yes, but it's a very very difficult option, expensive. It's a microsurgical procedure, and it carries increased risk of ectopic pregnancy. Okay, but if definitely the skill set is there, IUD sugar, you can give it a trial. But you must have at the back of your mind that there's going to be increased risk of ectopic pregnancy if you do get pregnant afterwards. Okay? Now, everybody, are you with me? I think my audio is still good, my network is still good, so let us crack on and fire on. Now, what can cause low sperm count? Now, I want you to all to follow me and follow my idea, the way I think. There's a part of the brain called the anterior pituitary gland. That part of the brain produces hormone called FSH, okay, and LH for the man, just the same way it's produced in the woman as well to make the woman ovulate. This FSH and LH comes from the brain, okay, into your bloodstream because it's an hormone. Every hormone in your body is produced, it will go into the bloodstream and will now go and focus its action on the target organ. For FSH and LH produced in the brain, the focus of action is on your testicles. That's your penis and your testicles there. So it focuses on your testicles, okay, to tell them, okay, produce testosterone, okay, which in turn acts on the growing sperm to produce and mature sperm. So if you're following me, if a man has low sperm count, 2 or 3 things could happen. The number one problem is that he is not producing enough hormone from here, that it's not getting down, okay? Or he is producing the hormone, is getting down, and the testicle producing sperm, but there's blockage. Let's use black. There's blockage in the sperm being produced, and they can't get outside. Okay, so there's a blockage there. That's another thing that can happen. Another thing that can happen is this person is producing this hormone, but is very low because they have genetic problems like Klinefelter syndrome. XXY, I've mentioned that before. It's an XXY syndrome. So this person looks like a guy, but is actually indeed a woman. There's no testicle, or the testicles are very, very atrophic, they're very tiny, and the person is not producing any sperm, no matured sperm at all. Okay, and number 4 that can cause low sperm count, which is not very common, is if the man has had his testicles removed for maybe cancer, testicular cancer, or maybe he has had chemotherapy in the past for treatment of other cancers in the body, and this chemotherapy or radiotherapy, they've caused damage to the sperm. Chemotherapy, radiotherapy, they have very, very high affinity to go into the sperm and damage the testicle to treat the cancer. In such a case, we'll have collected the person's sperm, frozen them to use them for IVF in future to get their spouse pregnant. Now, which one can we handle? We can't handle everything. For those that are going for chemotherapy or radiotherapy, guys, and obviously they've not had children before, or they want to have more children in future, the best will be to collect sperm, freeze them properly, and I'll suggest freeze them at 5 different places, especially in Nigeria, so that there's good quality assurance and there's less chance of confusion. Number 1. If you're going to have testicles removed for testicular cancer, the best thing will be as well to freeze the sperm or freeze testicular tissue, so that we have sperm there and even developing sperm there. Sperm are different. There are matured ones and immature ones. We can freeze them all and then use them at a future date to get your spouse or your future wife pregnant. If that is not the case, you got chromosomal problems like this XXY syndrome, the Klinefelter syndrome, we can't change it. If a person has a genetic problem, they can't produce sperm, there's nothing we can do to change. That's just nature. For such, you will need sperm donor to get the wife pregnant. Now, there are other ones we can change. There's a situation here where the man is not producing enough FSH and LH. For such cases, as far as there's no blockage in the semifinal tubules, we've done scan to check if there's what we call spermatocele, and there's nothing like that. What we can use to give injections to boost those FSH and LH hormone so that they'll make the person produce good sperm. It's very rare though, but it can be done. Another thing that can cause problems like this is the person is producing enough FSH hormone, the person is producing sperm, but there's blockage, okay? And there's blockage and the sperm can't get out. For such cases, we can easily do what? Go and aspirate the sperm from the testicles and use it during IVF to get the woman pregnant. If everything fails, when we talk about sperm donor, okay? To aspirate the sperm from testicles, there are things we call tessa. We can do it. They can do it. If you don't know where to go, you're going for IVF, you don't know where to turn to. I tell people all the time, we are still running a huge discount at the ATG IVF Center. You can approach us, call our office on Monday, or January 4th. We open back at the ATG IVF Center January 4th. And we'll go through every option. Chioma, the doctor there on ground all the time, very wonderful lady doctor, she's a wonderful person. She will go through the details with you. She'll go through options, the best option, and she'll offer you installment plan that will suit you at your own comfort to get it done. It's very difficult for most people to put $850 down for IVF. Very difficult. And to pay for the drug separately too. But she'll walk you through payment options that are very convenient for you, for your husband, for you as a couple, to make things happen. And also, she's there as well to consult with you to do basic hormonal profile tests, infertility tests, to know the reason for you not being able to get pregnant, the reason for your husband not being able to get you pregnant, to see what can be done. Omar Rejoice TV, how are you today? How are you? Thank you so much for joining us tonight. Omar Rejoice, she's always here on YouTube watching us. Now, you have an idea of the whole package now. Blocked tubes, low sperm count. How can we get it resolved? I know you're going to have questions now, so I'll start taking questions from people that are watching already on the screen now. So if you have questions on Facebook, put your question up. If you have questions on Instagram, put your questions up as well. Victoria Ekanem, thank you so much on YouTube. Abose Day Isiyemi, thank you so much, my sister. Abigail Tolulope Agbaje, Victoria Ekanem, and a lady from writing something in Russian. I don't know what that is in Russian. Thank you so much for being here. Now, how can you get to our location? Nkechi Olivia. Our address, phone number, and opening times will be put up on the screen to your message by one of our moderators now. Okay, so hold on to answer you now. Chioma, yes. Chioma, thank you so much. Dr. Chioma and Nosiemi, they're very wonderful. And our secretary there, Nike, she's also very, very charming and enthusiastic, ensuring that your problems and concerns are resolved. Thank you, Lady Brooks Mickey. How are you doing today? I missed you so much. Thank you for always joining us, Lady Brooks Mickey. Deborah Davis Izeko. Florence Ovichiguyen Adeho. Thank you so much for being here. Busayo Vincent Busi Balogun. Thank you. Marian Owusu. We don't have a branch yet in Ghana. We're coming soon. So hold on tight and fasten your seatbelt. Khadijat Hassan, how are you? And compliments of the season. Juliet Laden, thank you so much. Merry Christmas as well, and compliment of season. There's a question here. Abimbola Sheung Amoyele. What if fluid adenosine causes both tubes to be blocked? So I'll get to that. Hilda Ghana, you want one-to-one discussion with me? Go through our premium services. One of our members will give you answers, and she'll give you the link up to discuss with me. If I've missed your question, probably you've asked question while I was talking, I've missed your question. This is the time to ask questions so I can answer your questions now. So if your tubes are blocked through hydrosalpinx, it's as good as tubes blocked. Hydrosalpinx is caused by infection, okay? That's the way it does. It causes infection, the tubes are swollen, and in most cases, if we've treated before the hydrosalpinx with antibiotics, okay, we can check the tubes again if they are okay. But if the tubes are totally blocked and there's permanent hydrosalpinx there, the best will be to probably do IVF. And in fact, some will even advise you remove the tubes so as to reduce the risk of ectopic pregnancy and consider IVF. Okay. Hagar, Joseph, Ba, Ifeyiwa Lucy, Nduche, how are you? Adananya Edebona. Is there anything that can be done if the ovaries have been removed due to ovarian cyst? If you've lost both ovaries due to ovarian cyst, there's no way you can put it back. Once a particular organ has been taken away from the body, you can put it back in most cases. If you've lost your ovaries from ovarian cyst and they've been removed, then you have to consider egg donor and IVF. But if a part of the ovary has been removed, partial removal from a cystectomy on your ovaries are still okay if you're still ovulating, okay? How can low sperm count be treated? If you have low sperm count, yes, we can give you Fertilovit M. You can pick it up at our office anytime. Fertilovit M contains good vitamin support that helps to boost low sperm count. But if you have azoospermia, no sperm at all, then we have to go down this discussion I've discussed with you to know what is causing no sperm count in your case. But if it's just low sperm count, we can give you some vitamins, Fertilovit M, to boost your sperm count. And if you have low sperm count, it's always good as well to treat any infection that you might have and to regularly exercise. Those things will help to boost your sperm count beyond anything. Okay? Now, if you have high prolactin, we give you some medications to bring your prolactin down. Okay? HSG shows both tubes are opacified. That is to say, they can see both tubes. But they should also tell you whether they can see bilateral tubal spillage. So go back and check that HSG report. Okay? Baturi Kauna, how are you, my sister? God bless you. Yeah, can you get pushed in Abuja? Rehab preacher. Just call our office, speak with Nikki. She'll tell you if it's possible to get your priesthood rebuilt to Abuja, and she'll tell you the cost as well. Okay? Or any good pharmacy in Abuja that is reputable, you can pick up your priesthood there. Okay? Please, are you saying IVF is possible if the ovary has been removed? Yes, if your ovaries has been removed, if your tubes has been removed, if your tubes are blocked, IVF is possible. Okay? Yeah. Afolu Lokwe, you want to join ATG antenatal program? Please, can somebody help me answer this lady, wonderful lady on Instagram? Her name is Afolu Lokwe. She wants to join our ATG antenatal telegram class. So give her the link, okay? Yusuf Ukayat, same answer. Call our office, speak with Nike. She'll tell you how it's possible to rebuild or send your priesthood lubricant to your location in Ilorin or where you are in Kwara State. Okay? Thank you so much, Nna Fabrics. Thank you. Awesome. How much is priesthood lubricant? I have to check my files. But just call my office. See, I can't put all the prices in my head because I have to focus on giving you the best advice consistently. Priesthood lubricant, just call my office and speak with Nikki or Chioma. They'll tell you the cost of the priesthood lubricant. Okay? Thank you. Can swollen scrotum and pain cause low sperm count? Very unlikely. But if the scrotum is swollen, okay, and is damaged, it can be a cause of low sperm count. Okay? Our location in Lagos is there. Just follow the link down below. Ekpa Juliet, Gloria has already posted our link location in Lagos to you. How does it take prolactin to come back to normal after taking medication? In most cases, if you take the prolactin medication, it comes back to normal within 4 to 6 weeks. But you need to be persistent and take the medication consistently for those 4 to 6 weeks. And then at the end of the fourth week, we check your prolactin level to see that it's coming down and it's responding to the medication. It's important. Yes, Ayoyemi also needs the link to the antenatal program. Thank you. Doctor, your period is irregular. We need to know why it's irregular. Basically, we need to just run your basic hormonal profile test and to see which hormone is way out of normal and we can get that hormone back to normal. Precious Obodo, our location is down below. So you can follow our location. There's a question here from a lady that asking a question about arch. That question is gone. See, on Facebook, once question comes, it quickly disappears quickly before I read them. Because as I'm answering one question and that one's coming up, I miss the other one. So slow down, guys, so I can read your questions. I'm not a computer. I have to read, interpret, and answer. How can one ensure IVF success? Lose your weight, bring your weight down, your BMI down to at least 30 or less. Okay? Take Fertilovit M, Fertilovit F to boost your body metabolism. Regular exercise for the man, regular exercise for the woman, and also follow the advice given to you by your doctor. Okay? Olani Timileyin The same advice applies to you. Call my office, speak with Nike. She'll tell you how much this Fatlovit M is and how you can get it delivered to your location. Just speak to her, okay? What is the name of drug for hypolactin? It's simply Dostinex. We also have bromocriptine. They're very good to treat your prolactin level, but it's always good to get advice from a doctor so that they can guide you while you're using those medications to bring down your prolactin. Can one receive menstruation and still have blocked tubes? Yes, you can still menstruate and have blocked tubes. Menstruation, the mechanism of menstruation is different from what causes blocked tubes. So you can still menstruate and your tubes are blocked. Trust me. Fact. Trust me. In fact, our team members, moderators, can you help me put it up? You can still menstruate and have both tubes blocked. You can still menstruate and have blocked tubes. You can still menstruate and have blocked tubes. Blocked tubes, menstruation is not the same. Okay? Please help me put it up. What could be the cause of early miscarriage on several locations? Implantation defect, hormonal profile problems, very rare. Genetic problems, okay, or infections. They can cause poor implantation, okay. Low sperm motility affect IVF result? Yes, it can. It can. But in IVF, even if there's low sperm motility, we pick the best sperm to fertilize the woman. So that problem of low sperm motility will be taken over, treated by IVF, okay. So don't panic about that. Can you be menstruating and not get pregnant? Yes, it's possible. You can be menstruating and your tubes are blocked. You won't get pregnant. It's possible. Do you do genotype selection? Yeah, we can do genotype selection during your IVF process. We can do that, but it comes at extra charge. The cost, I don't know in my head. Call my secretary on Wednesday. She'll tell you about the cost of genotype selection during IVF. Okay? Yes, Nike's contact is already on the screen. Yemi, Becky, and Olaniyi Timileyin. You can see Nike's contact already on the screen. We've put it there already, so you can watch that. Thank you guys for listening today. I really appreciate you. I hope to see you again soon. Tomorrow, by God's grace, all things being equal. See, if I've missed your questions, please forgive me. It's not intentional. I'm human. These questions come very fast on the screen. I can't read them all. As I'm reading one, and I was popping up also on Instagram, on YouTube, I have to talk as well. So if I've missed your question, apologies. Watch the video over again. It's very possible that your question you were asking already has already been answered. We don't have any office location in Niger State yet. We don't have office in Niger State yet. We only have office in Lagos State for now. Okay. All the best. See you. Happy New Year in advance. Bye-bye.